Honduras is a country with an area of 112,000 square kilometers. The population is 8,423,000. The country is divided politically into 18 departments. The population is highly diverse, and the official language is Spanish, while the main religion is Christianity. Honduras has a young population, so the proportion of population under the age of 18 years is 44%, and the proportion above age 60 is 4%. The life expectancy at birth is 67.51 for males and 72.63 for females. The national income per capita is 101.16 per month. The literacy rate is 93% for men and 95% for women. In Honduras, 66% of population are living in poverty. In rural areas, 1 out of 5 Hondurans live in extreme poverty. The poor are at greater risk of suffering a mental illness such as depression because they face more difficulties in life and because they have less access to appropriate care. The neuropsychiatric disorders are estimated to contribute to 16.7% of global burden of disease. Honduras now has the highest per capita murder rate in the world, and its capital city is suffered from violence, poverty, homelessness, and sexual assault, with an estimated 80% of the cocaine entering the United States now being transshipped through Honduras. Depression is the most common mental illness in the world. In Honduras, 5% of adults suffer from it, but most neither seek nor receive treatment. The attitude may be partially due to a lack of information. In the worst of cases, depression can lead to suicide. An estimated 1 million people kill themselves every year around the world. Even when it's less severe, depression can affect daily life, work, personal relationships. In addition to the impact on personal life, depression can also affect a country's development, given that it's a leading cause of disability. The total expenditure on health as a percentage of GDP is 5.97%, and the per capita government expenditure on health is $108. In Honduras, the quality of and access to health care are directly tied to income levels. Adequate health care is available to those who are able to pay high cost. Health care for the urban and rural poor is extremely limited. Health services are not easily accessible to the majority of population in Honduras. An estimated 1.3 million Hondurans were without access to health care, and in some region of Honduras there are almost no physicians. The ratio of doctors to population is 1 to 1,510. There are 2 mental hospitals available in the country for a total of 370 hospital beds. 4% of these beds are reserved for children and adolescents. The admission rate in mental hospitals per year is 57 per 100,000 population. The average number of days spent in the hospital is 27. One of the 2 mental hospitals doesn't keep systematic records of discharge morbidity. Also, there are no psychiatric inpatient units in general hospitals in the Honduras. In order to address the problem of depression, international organizations have proposed strategies such as strengthening primary health care and mental health. This means making services available near all people in the communities and also assuring that general medical staff are trained to recognize mental illnesses. Coordination between primary care physician and specialist is also important for referring more complex cases to the proper specialists. The World Bank suggests to include mental health on the development agenda of Honduras to encourage economic and health officials to prioritize depression into their agenda.